Hello, everyone. Welcome back to our LAM CAA assessment. This time, we review the TCM pattern differentiations. So this is for batch 2. And today, we shall be reviewing diagnosis according to pathogenic factors. Let's welcome Dr. Anjali Templo. Let's start the ball rolling with the first question. Okay, Doctor, wind tends to injure what vital substances? So there are, yeah.
There are two. Yes, the blood and yin.
Very good. Blood and the yin. Okay, what are the characteristics of a wind?
It tends to be mobile and causes diseases with no fixed location. It also tends to cause vibration paralysis and rigidity.
Okay, so it's more of yang. Wind is
Yang
yang, and it arises and changes
and
very fast.
changes.
No, it's
Yes.
like so sudden. So wind, just like the wind. No, so the characteristics yang. What are the main manifestations of wind?
Um, it's there's rapid onset, rapid change, moving. It causes to tremor, convulsions, but also stiffness and paralysis. It causes to numbness and or tingling. Also can be blood deficiency. It affects top part of the body, and if it affects lung first due to external wind, and it also affects the liver due to internal wind, and it affects the skin like that of itching.
So its impact on the organs primarily for external wind because the lung is considered to be the lead of the organs. So it affects the lungs first. So wind. And lung is a yin organ, so it's easily affected by a yang pathogenic factor, which is wind. And the internal wind affects the liver. Uh,
Mhm.
So it's always the liver first. And then it affects the skin, so there will be itching. So anything that itches, you have to consider the wind as a pathogenic factor.
Yes.
Okay. External wind. Let's talk about external wind. Invades what body chi portion?
The lung defensive chi
Yeah,
portion.
the defensive chi portion of the lung. Or the wei chi, the lung wei chi, the first defense, no? External wind can combine with what other climatic factors?
These are cold, heat, damp, dry, and water.
Very good. What are the main manifestations of external wind? Earlier, we talked about wind in general. So this time we will focus on external wind.
External. Yes. There's aversion to cold, can cause fever, occipital stiffness, headache, and with a floating pulse.
Very good. So if it is not floating, it is not external. Okay.
Yeah.
External wind invading the channel of the face can cause what? This is very common.
Deviation of mouth and eyebrows.
Yes. So when you talk about this kind of involvement, it's always the channel of the face. So it's very easy to treat because it's just the channel that is affected. No. Number 8,
Yes.
external wind invading any young channel settling in the joint causes what?
Stiffness and joint pains.
So remember the young channel. So your answer should always be young, no? Gallbladder, what else? The stomach channel. Mm. External wind affects what main internal organ and causes what symptoms?
The liver.
Liver.
And the symptoms are migraine, headache, neck ache, from windy weather.
Okay. So external wind affects the lung primarily, but it can also affect the the main internal organ, which is the liver.
The liver.
So if the liver is affected, expect migraine headache and neck ache from windy weather. So one can have migraine um, in areas that are very windy. Okay. What are these signs and symptoms for? Like when you have a per patient presenting with aversion to cold and wind, sneezing, cough, runny nose, fever, occipital stiffness and ache, itchy throat, sweating or not, depending on whether wind or cold is predominant. So if it is cold, there is no sweating, no? And the pulse is floating. So what is the pattern here?
It's signs and symptoms of invasion of exterior wind in lung defensive chi.
Very good. So floating is the key word. Number 11. Exterior wind penetrates via what and interferes with what? So how does
It,
yeah,
yeah, it penetrates via the skin and interferes circulation of Wei Qi in space between skin and
muscles?
muscles.
Yes, that's muscles. Okay.
Ah,
So the external wind or exterior wind will penetrate via the skin, and this will impair the circulation or interfere with the circulation of the Wei Qi, which is located in the space between the skin and muscles.
okay.
Okay, what does defensive Qi warm?
It warms the skin.
It warms the muscles.
Ah, muscles.
Mm,
Sorry.
it's okay. Wind impairs circulation of Wei Qi. So when the wind impairs the circulation of Wei Qi, what does the person feel?
Cold.
There is aversion to cold. So a
Aversion.
person experiences aversion to cold when the wind impairs the Wei Qi circulation. And if the defensive Qi or Wei Qi is defensive Qi, is impaired by the external wind, so the patient will feel cold because the defensive Qi can no longer warm the muscles. Okay?
Mhm.
Ganun lang yun. So if the patient feels cold or there is aversion to cold, then that means the Wei Qi
Wait.
or defensive Qi was impaired or affected by external wind. How does wind affect the lung?
The lung controls spreading of Wei Qi and pores. Wind in skin and muscles interfere diffusing and descending of lung qi, so it causes to sneezing, coughing, runny nose with profuse white discharges.
Okay, very good. Um, lung controls the spreading of Wei Qi, and it also controls the closing and opening of the pores. No, so the wind in the skin and muscles will interfere with the diffusing and descending of lung qi. So the lung qi cannot diffuse, it cannot descend. So there will be coughing, there will be runny nose with profuse white discharge. Okay, the fight between pathogenic wind and the Wei Qi in the skin and muscles may cause what symptom?
Fever or feeling hot.
Very good. Wind attacks what superficial channel? This is actually the most superficial channel.
It's the Taiyang channel, the small intestine and bladder.
Okay, very good. And it okay, the wind will attack the small intestine and bladder, and it obstructs the circulation of Wei Qi, and this will cause stiffness and pain along the SI and bladder, particularly in the back and neck. Wind attacks what part of the body? Top, middle, bottom.
Top part of the body.
Very good.
Often it lodges in throat.
That's why we have
That's why it
itchy throat
causes itchy throat.
or sore throat. Itchy throat if it is cold. Sore throat if it is hot. If wind cold, so if wind is less than the cold, what do you expect the pulse and the symptoms to be? If wind predominates from cold, yeah,
No sweating, cold contract pores, and the pulse will be tight.
so if cold is predominant, there will be no sweating. Kasi remember, the wind it accompanies cold, no? So depends on which is more predominant. If the cold is more predominant than wind, there will be no sweating and the pores are contracted and the pulse is tight. However, if wind predominates, there is more wind than cold, the wind can open the pores, so there is slight sweating and the pulse is slow because it's wind cold. Okay. What is the manifestations of wind cold? Or what are, yeah.
There's aversion to cold, fever, sneezing, cough, runny nose with white, watery mucus, severe occipital stiffness, and ache. There's also no sweating, no thirst. The tongue will have a thin white coating, and the pulse will be floating and tight.
Very easy, no? Runny nose. Observe the mucus, white watery. Severe occipital stiffness and ache. No sweating, no thirst. Obviously, wind cold. What about wind heat manifestation?
There's aversion to cold, fever, sneezing, runny nose with slightly yellow mucus, occipital stiffness and ache, slight sweating, sore throat, swollen tonsils, thirst. The tongue is red on tip and sides with thin white coating, and the pulse is floating and rapid.
Very good. So the color of the mucus will distinguish wind heat from wind cold. And in wind heat, there will be sore throat instead of itchy throat. No? The tonsils are swollen, there is thirst, and the tongue red on the tip and sides, thin white coating. So it's normal coating. And since this is external or exterior, the pulse is floating, and because it's heat, it is rapid. Okay, what about wind dampness? What will be the manifestation?
There's aversion to cold, fever, swollen neck glands, nausea and sweating, occipital stiffness, body ache, muscle ache, body feeling heavy. Pulse is floating and slippery.
Okay, very good. So if the pulse is slippery and floating, that's definitely wind in combination with dampness. And we all know that if you have dampness, there will always be the feeling of heaviness, no? The body feeling heavy. Okay. There will be swelling. So remember, if there's dampness, there's swelling of the neck glands. Yeah. Next, what about wind dryness?
There's slight aversion to cold, fever, slight sweating, dry skin, nose, mouth, and throat, dry, cough, sore throat. Tongue is dry with white coating, and the pulse is floating and rapid.
Very good. So how do you distinguish wind dampness from wind dryness in terms of symptoms? So you will always look for dry. dry cough, dry
Dry,
throat, dry
dry
skin,
cough,
no?
sore
Sore
throat.
throat. Okay. So we have wind cold, wind heat, wind dampness, wind dryness. But the two most common would be wind cold and wind heat.
Mhm.
What about wind water? Yung mga naulan na. Wind water.
Mhm.
The manifestation will be the same as wind dampness. So can you tell us the manifestations?
There's aversion to cold, fever, edema, especially on face, cough with profuse white and watery mucus, sweating, no thirst.
Okay. And floating. The pulse is
Pulse is floating.
floating. So there is edema on the face. There's
Wind
edema on the
water,
face.
edema.
External wind can invade what channel? The channel of the what? Which is so common.
The face.
Yes, that's why we have
Face.
facial paralysis. No? Um, invasion of wind in the channels and joints is called, this is called the P syndrome, painful obstruction syndrome,
Obstructions.
no? In which the external wind invades the channel and settles in the joints.
Mhm.
Okay, let's now go to cold. What are the characteristics of cold?
Ian can be exterior and interior, full and empty.
Mhm.
Exterior cold is full, directly attacked stomach, intestine, and the uterus. Interior cold can be full and empty. Full from invasion of exterior cold, empty for the spleen yang deficiency and or kidney yang deficiency.
Okay, also cold injures the young. It congeals blood. Kaya it's very problematic to go to cold places, no? It congeals the blood. It contracts your tissue and it causes clear discharge, not heat. And the first organ, um, and very critical dito is when the kidneys are affected. Okay. Uh, what is a cold manifestation? No distinction between full and empty.
Feel cold, cold limbs, thin, clear discharge, pain of spastic or crampy, aggravation from cold, and alleviation from application of heat, desire warm water, no thirst, white complexion, tongue is pale and white, the pulse is tight and full. If it's tight if it's full, and if it's empty, it's slow.
Okay, very good. Easy, no? Cold. Okay, external cold invades what chi portion?
Lung Wei Chi portion.
So the same thing as external heat, no? What
Yes po.
um assists or helps the cold? Sino yung
Wind.
kakontsaba ni cold? Yeah, it's the wind. That's why we have wind cold. What are the signs and symptoms of invasion of the channel and joints by cold? So you have to be very familiar with the channels, no? So what do you call this syndrome?
The one you mentioned a while ago, the painful obstruction syndrome.
Okay, that's the B syndrome, BI, no? Um, you will note that this there is channel and joint involvement by cold because only one joint is affected. Okay, only one joint. It's not bilateral. What are the signs and symptoms of cold invasion of the muscles and sinews?
Local pain. There's
Yes.
local pain.
Did you know that the pain due to cold is very painful? Yeah, and stiff.
Mhm.
Uh-huh. So, number 30, what organs are invaded by external cold?
the stomach, intestine, and the uterus.
Very good. Especially women who lie on the floor and your floor happens to be cold or
Cool.
you make babad in the pool, diba? There.
Mhm.
And of course, when you say external cold affecting the stomach, it's actually what you eat. Especially, there are people who cannot eat ice cream without having any abdominal pain. Okay, and also the
Mhm.
next, internal full cold originates from,
External cold.
yes, very good. It invades certain organs directly. In what are the manifestations of internal full cold?
Still there's feeling of cold with cold limbs,
Mhm.
thin, clear discharge,
Mhm.
severe pain, aggravated by pressure, aggravation by cold, and alleviated by heat, like warm drinks but not thirsty, bright white complexion.
Yeah, that's why make sure that your room is not too cold because if the patient comes in because of internal full cold, then he will be in pain the whole time. No. Mhm. So the tongue is thick, has a thick white coating because it's full cold, and the pulse is slow, full, and tight. What are the manifestations of internal empty cold this time?
For internal empty cold, feel still they would feel cold with cold limbs, thin clear discharge, dull pain, alleviation by pressure, aggravation by cold, alleviation by heat, like warm water but not thirsty. This time it's bright white complexion.
Yeah, and the tongue is has thin white coating.
Thin white
Um, you may not
and
actually see
pulse
any abnormality in the coating, but the pulse is slow and weak.
in weak
Next, what are the characteristics of summer heat? So we're done with cold. Let's now proceed to summer heat.
summer heat. Young. It's a young, only external pathogenic factor. Summer.
It is the only external pathogenic factor. Next. Okay, so there is no internal. Okay. So what are the
External.
manifestations of summer heat?
Fever, aversion to cold, sweating, thirst, feel heaviness, headache, uncomfortable sensation in epigastrium, irritability. Tongue is red on tip and sides, white and sticky. The pulse will be saggy due to blood, iron deficiency, damp, and rapid also. For Dampian, and is a seasonal pathogenic factor invades top of the body, has some interior heat and harbor dampness. This damp is not accumulation of body fluid, it is a change to other pathogenic factors. Dampness also comes with dryness.
Okay, very good. What are the characteristics of dampness? Mention four.
Yin, heavy, dirty, and sticky.
Great. Manifestations of dampness.
Feel heaviness, poor appetite, feel fullness, sticky taste, urination, difficulty, vaginal discharge. Tongue is sticky, pulse is slippery due to phlegm, fluid, food stagnation, excess heat, pregnancy. Also saggy because of blood, iron deficiency, and darkness.
Very good. Let external dampness invades what chi portion?
Lung Wei Qi.
Okay, still with long way chi. External damp can combine with
External damp heat, external summer heat with dampness.
good. External dampness can invade what organ?
the bladder, gallbladder, stomach, intestines, and uterus.
Very good. External, let's discuss, okay, the manifestations of external dampness invading blood.
Difficult and pain on urination with acute onset. Scanty but frequent cloudy urine. Feel heaviness in lower abdomen. The tongue is thick and sticky. The pulse is slippery. If in association with heat, burning sensation on urination, dark urine, thirst but don't desire to drink. Tongue is yellow, pulse is slight and rapid.
Very good. Completo. Okay, what about external dampness invading the stomach?
There's acute onset of vomiting and or watery diarrhea without cell, epigastric pain, feel stuffiness of epigastrium, cold limbs, no appetite. The tongue is white, thick and sticky. The pulse is slippery.
Good. What about external dampness invading the intestine?
There's acute onset of watery diarrhea without cell, abdominal pain, and feel heaviness.
The tongue.
Oh,
The tongue is white, thick, and sticky, and the pulse is slippery. External dampness invading the uterus.
There's acute onset of painful period, excessive vaginal discharge. The tongue is white, thick, and sticky. The pulse is slippery.
Very good. What about external dampness invading the gallbladder?
There's an acute onset of hypochondriac pain, bitter taste, and feeling of heaviness.
Yeah, and when you look at the tongue, it's sticky and yellow on the sides. This is too obvious. Makikita mo talaga on the sides. The pulse is slippery. So you can usually see this on patients with dyslipidemia, those with high liver enzymes. Okay. Number 46, dampness invading the channel of acute external dampness.
At an acute stage of painful obstruction syndrome, the BI syndrome, achy and swollen joint with heaviness occurring sudden onset.
Okay. If only one joint is affected, that's called dampness. If several joints are affected, that's damp heat. Dampness invading the defensive chi level or external damp heat manifestations.
Aversion to cold, fever, higher in the afternoon, body feel hot to touch, swollen gland, headache as if wrapped, feel oppression of chest and epigastrium, sticky taste, no thirst, and no drink.
The tongue would be white, sticky, tongue coating, and the pulse is soggy. This is, it's like the piece of cotton, yung soggy. Okay, this is different from soft. Next, number 48, dampness invading the defensive chi level manifestations. External summer heat with dampness.
There's slight aversion to cold, fever, sweating, headache, fear of heaviness, epigastrium, uncomfortable, irritable, and there's thirst.
And the tongue is red or sticky if there is summer heat. This is actually summer heat, no? And the pulse is soggy, rapid. Next, what are the characteristics of internal dampness, both acute and chronic? Let's start with chronic.
Chronic Internal dampness in internal organ, uh, chronic dampness in channel, for acute damp heat at sea level.
Okay. So for there will be acute episodes of chronic internal dampness. And the last one for Dr. Templo, what organs are affected by chronic internal dampness? Everybody should be familiar with this because most of us can relate to this. And this is the reason why we see a lot of people having these issues. Doctora.
Uh, these organs are the bladder, gallbladder, liver, kidney, stomach, and spleen and entity.
Yes. Just like the
Yes,
bladder, it
sir.
does not only concern the formation of stones, it also affects the prostate in men, no?
Um,
Okay, yes. Kaya maraming may prostate issue. The gallbladder, I'm sure all of you are familiar with gallstones, no?
yes, sir.
Liver, everyone is familiar with fatty liver, no?
Mhm.
Kidney, I think everyone is familiar with kidney kidney yang deficiency, no? So that's too much dampness. Stomach and spleen, and yeah, stomach, spleen, intestine, like the large intestine, just like my patient earlier, no? She had colorectal carcinoma, third stage. She was receiving chemotherapy, and what we could do is to just mitigate the side effects of the chemo. So, yun. Who knows, diba? Effect. It might even work if we do acu. Thank you so much, Dr. Templo. Well
Thank you, Doc.
researched. Congratulations. Perfect talaga.
Thank you po.
Thank you po. Let's now call on Sir Victor Ginto. Good afternoon po.
Good afternoon, mga docs.
Wow, thank you. Good afternoon po. Can you continue po? Like, what are the manifestations of chronic internal dampness invading the stomach and spleen? Okay, bakit ito very relatable? Because practically everybody loves to eat good food, no?
Opo. Epigastric and abdominal fullness and heaviness.
Mhm.
Nausea, vomiting, sticky taste, loose stools with mucus. Sa tongue is sticky,
Ang coating.
pulse is saggy.
Very good. What about chronic internal dampness invading the bladder?
Tongue is sticky on root. Pulse is also saggy. Urination difficult with slight or no pain. Cloudy urine.
Yes, very damp. What about chronic internal dampness invading the intestine?
The tongue is also sticky on root and pulse is saggy. There is abdominal fullness and heaviness, loose stools with mucus.
Yeah. When you look at the tongue, the coating is sticky on the root and the pulse is saggy. I would like to believe that this is the prequel to cancers, no? The moment it becomes phlegm. Remember, di ba? Dampness can, if not treated, can become phlegm. Okay? Chronic internal dampness invading the uterus.
Uh, Tongue is also sticky on root and pulse is saggy. Abdominal full and heavy. Vaginal discharge, mid-cycle pain and or bleeding, painful period.
Okay, so for women, don't ever forget to ask vaginal discharges. No? So if their response is positive, then that's definitely dampness, internal dampness. Next, chronic internal dampness invading the gallbladder.
The tongue is unilateral sticky.
Yeah, only one side po.
Yes. Then the pulse is also saggy. Then hypochondria, full and pain.
Yeah, there is pain. What about chronic internal dampness in the liver?
Tongue is also sticky and root and pulse is saggy. Pag may dampness. So urination is difficult and pain, cloudy urine, hypochondria, full, and distension. Vaginal discharge, genital sores, and
Yeah.
itchy.
They will always have problems with their genitals, no? Ng mga sores. Because liver, malapit na siya sa genitals. Or it actually encircles. Number 57, chronic internal dampness invading the kidney.
Also, tongue is also sticky on root, pulse is saggy. Then there is urination is difficult with pain,
Mhm.
cloudy urine, feel heaviness of back or backache.
So do not forget to ask kung may backache or may knee pain. So that means the kidney is already involved. Next. Chronic internal dampness invading the channel, which is a chronic dampness. What do you call this syndrome?
Uh, Painful obstruction syndrome. So damp painful obstruction syndrome
Okay.
with aching, then swelling, and heaviness of the joints.
Okay. So if the if it is this is also called damp B. Okay, because painful obstruction syndrome is B syndrome. No? So if
Mm.
this damp B or damp painful obstruction syndrome, expect swelling. There is always swelling and the feeling of heaviness of the joint. No, there will be maga. So that's definitely dampness. And of
Yeah.
course, be aching. Okay.
Baka
Next.
may edema rin, no?
Opo.
Okay po.
Ano po yun?
Baka may kasama ring edema siguro.
Oo, edematous. Maga siya talaga. Swollen. Oo, kaya dampness. No? So what about chronic internal dampness invading the skin?
Vesicle, papule, skin lesion, causing fluid with puffiness of skin.
Okay. So may makikita ka na sa skin na may, vesicle, no? What is a vesicle? Yung parang may tubig sa loob.
Mm.
Dampness yan eh. Papule. This is different from macule. Macule kasi hindi elevated. Ito elevated ng konti. Okay? That's chronic internal dampness. Lalo na yung mga batang kumakain talaga ng puro lang matatamis. Yun. Number 60. What are the symptoms of acute internal dampness?
Interstitial cystitis, which is bladder pain, pressure generally of exterior origin.
Okay. Galing sa labas. So you can have interstitial cystitis. Okay. What are the characteristics? Okay, we're done with cold, done with dampness, heat. We're now going to dryness naman. Remember, puro lang pathogenic factors ang pag-uusapan natin today, no? Now let's proceed to dryness.
It's young
Mm-hmm.
and more on autumn season,
Yes.
lung, dry throat, lips, mouth, skin, stools, scanty urination.
Okay, so pag dryness, sensitive dyan si lungs. No? So dry throat, lips, mouth, skin, puro dry. Dry stools, dry skin, everything is dry. Next, what are the characteristics and manifestations of external dryness?
It
Galing sa
arises it arises from the invasion of exterior wind dryness.
Mhm.
There is aversion to cold, dry cough, the tongue is dry, and the pulse is floating.
Okay, so this is the only way of knowing kung external pa, no? Mafe-feel mo na yung pulse. Supposedly, wala kang mafe-feel sa superficial, but this is floating. So, pag may floating, definitely that's external. Okay? So,
Mm.
yun. Um, dry cough. Diba, this is very annoying. Your cough is dry, tapos may aversion to cold. Number 63, internal dryness naman tayo. Characteristics and manifestations.
Arises from external dryness. There is yin deficiency. Itself is internal.
Yes. Because,
Excess, sige po.
sige.
Excess dry foods,
Mhm.
irregular eating, which weakens the stomach yin, excessive use of voice, which weakens lung yin,
Mm.
excessive sexual for men,
Mm.
weakens kidney yin, chronic menorrhagia for women, which weakens blood, liver, kidney yin, and smoke, lung and kidney yin.
Okay, so very interesting, di ba? If you eat excessively dry food, no, this will cause internal dryness. Also, if you do not eat on time or irregular, pabago-bago yung schedule mo, this you can have stomach yin deficiency. And those who use their voice a lot, like teachers, singers, magkakaroon din ng lung yin deficiency. Excessive sexual activity for men, humihina ang kidney yin. For women, chronic menorrhagia, this will weaken the blood. Of course, nagbi-bleeding no? Liver and the kidney yin. And those who smoke, so automatic yan, isipin mo na lung and kidney yin deficiency. Next. What are the, so let's talk about the internal stomach dryness, characteristics and manifestations.
Dry mouth, tongue, racking tongue. Stomach is the origin of fluid. If the fluid decreases, there will be yin deficiency.
Very good. What are the causes of internal stomach dryness? Bakit nagkakaroon ng internal stomach dryness ang mga tao?
Eating at night, because it uses the yin for digestion,
Mhm.
cause yin deficiency.
Mhm.
Also eating in a hurry and going back to work straight after eating.
Very good. Sino ba nakaka-relate nito? I'm sure madami. Pag marami kang ginagawa, pagkakain, trabaho ka agad, no? This can cause stomach dryness, internal stomach dryness, or stomach indeficiency. Number 66. What are the causes of internal lung dryness and the manifestations?
The excess use of voice over many years cause to lung qi deficiency. Then also results in dry mouth, throat, cough, tongue, skin, stools, hoarse voice.
Okay, very good. So, hindi din pala maganda maging singer or teacher, no? Okay, what are the causes of internal kidney dryness and manifestation?
excessive sexual for men, chronic menorrhagia for women, smoking. It will have dry throat with small sip of water at night, scanty urination, tongue with cracks, dry menstrual blood, dry skin.
Very good. Easy, no? What?
Mm.
Okay, punta na tayo sa fire. What are the characteristics of fire?
This young, it's a primarily interior pathogenic factor.
Okay.
It's a physiological fire, galing sa fire of the gate of life. Also, pathogenical fire. Sample is liver fire.
Okay. So meron tayong physiologic fire and also pathogenic fire. Next, what are the similar characteristics of heat and fire?
It causes thirst. You will feel the heat.
Mhm.
It produces mental restlessness
Okay.
and red tongue, rapid pulse.
Very good. What are the differences between heat and fire?
The fire is more solid and dry out. It can be seen through dark scanty urine and dry stools. So the fire moves upward, producing mouth ulcers.
Mhm.
The fire damages blood vessels. It causes bleeding.
And also, the fire affects the mind more than the heat. So this will cause anxiety, mental agitation, mental illness. No?
Ah.
Number
Yeah.
71. What is the nature of fire?
Nature is, it rises to the head. It is dry fluid. It injures blood and yin, causes bleeding, affects the mind.
Very good. What are the general clinical manifestations of fire?
It's a young pathogenic factor and it rises.
Mhm.
It's very drying, damages blood and yin,
Mhm.
causes bleeding, has potential to general wind. It affects the mind, may cause ulcer with swelling in the case of empty fire.
So that's why if you're very angry, ang dami mong fire, pwede kang ma-stroke, pwede kang magkaroon ng wind. No?
Yes po, yun ang nangyari sa akin.
Clinical manifestations of fire. Okay, this time, madam, makaka-relate kayo talaga.
Red face and eyes,
Did you have
feel
that before?
to some of these.
Yes.
Yes. Dry mouth, bitter taste, constipation. Itong constipation after nung stroke eh.
Okay.
Scanty dark urine, thirst, mental agitation,
Mhm.
dark purple spots under the skin, and bleeding, hemorrhoids. Wala ako nito. Then, hemoptysis, coughing with blood. Di ko to na-experience. The tongue is red or yellow dry or with yellow dry. Tapos the pulse is full rapid.
Yeah, yellow dry coating. Anyway, which of this na meron ka? Which of these symptoms?
Na experience tong siguro itong red face and eyes, heat,
Mhm.
dry mouth, bitter taste, tapos
Okay.
mental agitation,
Okay.
then
How old were you when that happened?
60. Last year lang.
Okay. Buti madali lang, no? Madaagapan. Swerte.
Maaga pa lang. Acupuncture.
Oh yeah. Nakatulaki talaga ng tulong. Okay, so what are the so-called exogenous pathogenic factors?
These are infections, acute upper respiratory infection, wind cold, ano ba to? And other etiological factors.
Yung minention natin kanina, no?
Yung anim.
Yung anim. Yeah. Oo. And of course, yung minention mo rin kanina, yung pestilence ang tawag niyan. The strong infectious pathogenic factor. We're done with wind, dryness, cold, dampness, summer heat, and heat. Fire.
Yes.
And also the yeah. Okay, what about the endogenous pathogenic factors, yung galing sa loob, that can cause illness?
Nakita ko dito is one, emotions.
Mhm.
Two, love is an action, not emotion. Three, each organ attached to emotion.
Okay, all
There's
7 emotions, improper diet, and overstrain.
overstring. Yes.
Okay, what are the secondary pathogenic factors? Ibig sabihin, the result of the other pathogenic factors.
Secondary. Nakita ko dito, joy, anger, sadness.
So ano yan? Yan yung internal pathogenic. These are phlegm, retention of fluid, and blood stasis. Okay? Phlegm, retention of fluid, blood stasis. Okay, what are the other pathogenic factors? Ito
Diet.
Yeah. Na-mention na yan kanina, improper diet. Various traumatic injuries, kasama din yan po. Injuries due to physical and chemical factors, injuries caused by insects and animals. Okay, let's talk about the 6 climatic factors or 6 evils. What are the features in
Wind, cold, heat, dampness, dryness, summer heat.
Okay. It is related to the seasonal changes and living conditions, no? They may singly or collectively attack people. So, nakaka-cause din sila ng sakit. The nature of disease caused by the 6 climatic factors may be the same as or different from that of the 6 climatic factors. So, pwedeng opposite yung effect. Okay, example, cold can cause cold syndrome, but cold can also transform into heat syndrome, which is a little bit weird, no? It invades people from the skin into the muscle or from the mouth and nose, going to the lung, and defensive qi, leading to... So of course, if you affect the lung qi, affected din po yung ating wei qi or defensive qi. And so this will lead to the emergence of exterior patterns. After further development, they may cause interior patterns. So what we would like to do is hindi mag-interiorize yung mga exterior. And some climatic factors, however, can cause interior syndrome directly. Okay? So what are the 7 emotions and mention their effect on the chi? Yeah.
Anger.
Okay.
Joy.
Yung effect niya po sa ating chi.
Yung anger.
Paakyat ba yung chi o tumataas?
Anger, tumataas.
Okay. What else? You just mentioned one.
Joy.
Yes. Anong ginagawa niya sa chi?
Dinidisperse ba yun?
Nire-relax niya yung chi.
Nire-relax ako.
Okay, what about
worry?
Yeah, nandito na oh.
Worry.
Anxiety. Anxiety will affect the lung.
The lung.
So this will inhibit the chi. So what will happen? Aatakihin ka sa puso. Hindi, yung mga ano mo, ma-impaired na yung function ng organs mo. No? So let's try not to be so anxious. I have a patient Actually, kababayan ko siya. He was having anxiety issues. So, yun. Okay. He told me he was feeling better. No? But matagal yung treatment nito. Ang nangyari, since na-inhibit yung chi, hindi na siya makahinga. And then, so you had to treat the anxiety. Kasi lalong dumami yung phlegm niya. Okay? Sorrow will affect the lung and it will stagnate the chi. Pag nag-stagnate po ang chi natin, there will be pain. No? There will be pain. Chi stagnation, remember? Thought, isip-isip or thinking will affect the spleen. It will also cause stagnation of the chi. Kaya isip ng problema, malungkot, magkakaroon tayo ng pains. Magkakaroon ka ng chi stagnation. For fear, it will affect the kidney. It will disturb the chi. Fright, it will drive the chi to move downwards. Ano po ba ang difference ng fear sa fright?
Yung fear, parang more on, parang chronic siya eh. Itong fright, acute, yung biglaan, takot bigla.
Ang fright, no? Ang fear kasi matagal na. Ito yung mga phobias. So nakaka-disturb din ng chi. Okay, let's talk about food retention. Can you tell us what causes it? What are the clinical manifestations and the syndromes involved?
Meron ako tong pag sa tongue is thick coat, pag sa pulse is full and slippery, manifestations, foul breath, belching, insomnia. Yun lang meron akong sagot.
Let's discuss muna how the food retention is formed. No? Too much food intake. Sobrang kain. Lalo na pag fiesta. And dysfunctions of the spleen and stomach. So magkakaroon ka talaga ng food retention. Okay, so clinical manifestations, anorexia, ayaw mo kumain, eructation with fetid odor and acid, regurgitation, vomiting, nausea, abdominal distension, epigastric pain, diarrhea or constipation, thick tongue coating, you mentioned this, no? Slippery, forceful, excess yan eh, and rapid pulse. Syndromes involved, food retention in the stomach and intestines, food retention with deficiency of the spleen. Next, what about overwork? Ano ang impact niya sa health natin?
Overwork produces physical damages on the kidney. Then mental damages, also damages the spleen. It has impact on digestion.
Okay. Overstrain, ito yung physical hard work, ginagamit mo yung katawan mo. This will impair your chi and blood. So nagkakaroon ng chi deficiency, blood deficiency. Okay. Overwork with the mind, affected din yung heart and spleen. Kaya tumataas yung sugar, nagkakaroon ng heart issues. Excessive sexual activity, it will impair kidney essence. Kasi overwork din yan eh, excessive sexual activity. Okay. Cold is a yin pathogenic factor and injures blank, especially blank.
Yang.
Especially what?
Yang chi.
Kidney yang.
Kidney yang.
Kaya nanlalamig sila, di ba? Malamig yung paa, malamig yung, actually yung legs eh, malamig. When does cold invade the body?
Any time of the year,
Very good.
especially in winter.
Interior full cold derives from
From external cold.
Okay.
Yeah.
Invasion of exterior cold lodging into the internal organs. Interior empty cold is caused by
Interior cold consumes yang, giving rise to empty cold.
consumes yang full cold na.
Full cold pattern can turn into empty cold.
Okay. Spleen or kidney yang deficiency. No? So, ang causes, full cold that damages the yang. Tapos na yung yang. And then, it is also caused by spleen or kidney yang deficiency. Kung nakikita nyo, magka-teamwork talaga si spleen yang and kidney yang. No? They depend on each other. Kasi, if the kidney yang is deficient, the spleen cannot carry out its functions. So pag hindi naman nag-carry out syempre, di ba, magkakaroon ka ng spleen yang deficiency, walang TNT, transformation and transportation, this will also cause an impact on the kidney. Next, what are the first organs to be affected by cold?
Lung defensive chi portion. Tapos channels and joints, muscles and sinews, stomach, intestines, and uterus.
Kidney and spleen.
Malayo. Malayo pala siya.
Kidney and spleen. Cold yan. Matapang si cold. Okay, cold blank blood. Anong ginagawa niya sa blood?
Congeals.
Yes, very good. How does cold cause blood stasis?
Since cold congeals blood,
That's
it
how it causes.
produces blood stasis.
Okay, very good. When blood stagnates, there is intense pain. When the stasis derives from cold, the pain is accompanied by
Chilliness.
chilliness. May chilliness talaga. When blood stagnation derives from cold, can it be alleviated or aggravated? How?
By the application of heat.
Okay, alleviated by warmth, aggravated by cold. Why does cold cause pain? Mention 3 reasons.
When blood stagnates, there is intense pain. Isa lang yung sagot ko.
It impairs the movement of the chi in the channels. Tumitigil siya talaga, so nagkakaroon ng pain. Kaya minsan nga, hot compress lang nawawala na. No? It contracts and contraction will cause pain. And number 3, it causes blood stasis. Katulad sinabi mo kanina. What does cold contract? Ano yung kinocontract niya?
Muscles and joints.
Yeah, the tissues, the muscles, the sinews, the blood vessels, and the skin. Cold contracting the muscles and sinews will cause what?
Stiffness, contraction of muscles,
Yes,
pain.
stiffness and pain. Cold causes blank discharges.
Watery discharges.
Yeah. Thin, clear, thin, watery, clear white discharge from the nose. So, pag may lumabas na plemas, alam mo na kaagad what is the pathogenic factor or the external pathogen. It's cold. And if the urine is very pale, the stools are watery and loose, and the vaginal discharge is clear and watery. Okay. Kanina we talked about cold primarily injuring the kidney and spleen, yung first 2 organs. But it will also affect what organs?
The lungs.
Actually, ang lungs, madaling maano ng dryness. No? Stomach, Diba? Heart,
Mm.
intestines, and uterus.
Okay.
Pain from cold is of a blunt nature. Anong klaseng pain to?
Yin nature.
Spastic or crampy.
Mm.
Yeah. Have you experienced this?
Ay, oo. Opo.
Pag sa Baguio.
Kahit dito pagka malakas yung fan,
Ayan. Spastic siya. Spasm. Crampy. Okay, P syndrome. Alam naman natin what is P syndrome. It's painful obstruction syndrome caused by invasion of channels and the joints by cold, is characterized by
pain and stiffness in the muscle and joints.
okay,
Pain
intense
is, sige,
intense pain in a single joint, aggravated by exposure to cold and alleviated by heat. Okay?
okay.
So, ano kaya ang makikita natin sa tongue pag ang pain is due to cold?
Pagka, ano, pale, at saka white,
Will it be dry
outing
or will it be moist?
will be dry,
No,
moist.
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 Moist siya. External cold can invade
The stomach, intestines, uterus, muscles,
ito na yung
channel.
sinabi mo kanina,
Yes.
the weighty portion of the lung. Okay,
Mm.
external cold ang cause niyan. Okay, channels and joints, so it will cause P syndrome. The channels and sinews, local pain and stiffness. The stomach, intestines, and uterus. External cold invades the muscles and joints directly. This is especially common in the muscles of
Uh, knees and
no,
shoulder.
shoulder and neck. Kaya nga
Shoulder.
yung iba naglalagay ng shawl, no?
Mm.
Makapal. Huwag kalimutan. Kasi sumasakit. Number 100. Okay, the last one. Can you compare the pulse for interior full and empty cold?
Interior is excess,
Mm-hmm.
then
Tight
type
siya.
plus is slow.
Yeah.
Slow.
What about empty cold?
Empty, cold, deficient, and cold parang ano rin
Slow and weak. Actually,
Slow.
pareho silang slow. Sa
Mm.
full lang, syempre excess ang full, no?
Mm.
And tight. Samantala sa empty cold, it's
Deficient.
okay. Thank you so much, Sir Victor. You did well.
Maraming salamat din po.
Thank you for joining. And we hope the others can catch up next time. So, kita tayo ulit sa Tuesday. Will that be okay?
Sige po.
Oo.
Yes, Doc.
We'll send thank you, Dr. Templo. And
Yes,
of
Doc.
course, Sir
Thank you din po.
Alex. Yeah. So, maybe yung iba makaka-attend na on Tuesday next week. Maraming salamat po. Thank you po.
Salamat po, Doc.
Thank
And
you, Doc.
ingat po kayo. Walang ulan sa CDO, no, Doktora?
Wala naman po, Doc.
Oo. Diyan ba sa Manila, Sir? Sa Cavite, Sir Victor?
Panay pong ulan.
Until now?
Ngayon na humupa. Pero yung sun, wala pa rin yung sun.
Okay. Sige, ingat na lang. So, ibig sabihin, magkakaroon ng dampness and water, wind, water. Yun.
Sa ano po, sa inyo, kumusta?
Walang ulan ngayon.
Walang ulan dyan sa Dumaguete.
Kahapon, medyo siguro. Pero kahit masyadong maaraw, pero amazingly, hindi siya mainit. Masyado. Hindi siya mainit. Unlike nung wala pang enteng. Ano na lang yan parang habagat na lang, no? Oo.
Opo.
Yeah. Ingat po kayo dyan sa Cavite. And thank you
Yes,
so much. Let's meet each other again on Tuesday. Maraming salamat, Doktora, Sir
Thank
Victor,
you, Doc. Thank
and
you, Sir Vic.
Alex. Thank you so much.
yes.